Bariatric surgeries are new to India. We have started hearing about bariatric surgery very often because they are showing up very good results. Bariatric surgeries are conducted by laparoscopy, that is keyhole incisions. What we do is we make the stomach size small so the person lands up eating less quantity. So we remove some part of the gut where we make the appetite go down. One of the few surgeries are called as restrictive procedures. Few other surgeries are called as restrictive with malabsorptive procedures. Now in malabsorptive procedures, we initially make the stomach size small and the most absorbing area of the first part of the intestine, we bypass that, and that's why these surgeries are called as gastric bypass surgery. Now this helps in dual way. This helps treating your metabolic diseases like diabetes, high blood pressure, your endocrinal problems like thyroid, your kidney issues, your heart issues, and it helps immensely to get a person normal as early as possible. These surgeries are done by laparoscopy. This is about 1 hour surgery. Patients stay in the hospital for 2 days. Third day, the patient leaves hospital, is discharged healthily. Fourth day, the person can start going back to its normal activities, even to their own work. And rather, we doctors, we push them to go for their normal work. Fifth day, we put these patients on exercise mode. Exercise is not for weight loss after the bariatric surgery. Exercise are meant for muscle toning because the muscle fibers should not go sagging. 10 days post surgery, we advise them body massaging program for the skin toning. So, and this completes the whole surgical management by bariatric surgery to any morbidly obese patients. The most important thing after a bariatric surgery is the follow-up, which is not seen in other surgeries in medical world. Because this is a lifestyle disease, we have to follow up with these patients at least for 2 to 5 years. Now why? Is because post bariatric surgery there are going to be lot of changes in their diet pattern, in their exercise pattern, in their medication pattern, in their day-to-day working pattern, because these patients come with lot of comorbid situations, problems, day-to-day problems a lot. So their medications needs changes often. Their diet, we start with clear liquid diet, then we put them on semi-liquid, semi-solids, and then solids. Eventually the patients are going to eat normal, dal, chawal, sabji, roti, but they should not, but initially, immediately after surgery, it will take a little bit while. It's like a baby is born. Initially baby is on just on the mother's milk, then they go on to puree diet and then on to solid. Same thing here, initially clear liquid to solids in a period of some time. Apart from this diet, we force our morbidly obese patients who have undergone bariatric surgery about the exercise schedule, about how do they look, because there are a lot of changes are going to happen in their psychological setup also, where they need a boost, morale boost, which we call them every 3 months in first 1 year, when we talk to them about their eating pattern, their lifestyle pattern. Every 6 months post surgery, we get them investigated just to understand, because of small meal volume program, they are not nutritionally going imbalanced. So all these factors we have to keep in consideration for at least 2 years, because 2 years later most of the patients have already come to their near normal body weight, and then they start thinking now I'm done, and then they start and go back to their old bad lifestyle, and they may regain their weight back. So to avoid this, all these post bariatric patients should follow up with their own doctors or whoever doctor referred by their bariatric team. It's a very good question. Myths about side effects of this surgery. Every person who wishes to undergo any surgery would want to know what are the side effects of the surgery if I wouldn't do this. But these are all myths. A lot of people think that the God has given me this body and you are playing with my body. It's not that. What we do is, whatever that excessive expansion of any organ which has already become abnormal, that is what we are bringing it to normal. It's like the nail grow and we clip the nail. It's like hair that grow and we cut hair. Is it abnormal? No, because it's normal because we are getting it back to normal. So same thing, the excessive expansion of the stomach, we make it small to come to a near normal organ. So that gives us all the advantages by this surgery. So we are not at all playing against God. Second commonest thing is, doc, will I be vomiting? If you do anything excess, that you may vomit. But when you get information immediately after your stomach is full to your satiety center that you are full, don't have more. And that is where if you stop, you never vomit. Thirdly, people ask me, doc, will I have hair loss? The hair loss is also not there. Even if it's there, and that can happen with just on diet program also, and not only because of surgery. If that happens, you just have to increase your protein intake and the hair loss is temporary. Then there are other questions like, doc, whether we'll have any weakness or anything. But post bariatric surgery, as I just now said, we get them investigated every 6 months till 2 years after the bariatric surgery, and post that 1 to 2 years later, patients are normally taking the normal food and we don't give any supplement. Whatever is needed, that only is given to that particular person after checking the nutritional status. Blind consumption of any supplement is also bad. Now here we conclude with a very strong message for the society. Adequate consumption of the calories, adequate mental and physical rest, and adequate exercise to one's body. By these three things, the word adequate to be underlined, you can maintain your good lifestyle, and this is what is necessary for you to remain healthy